In Paris, President Joe Biden's vaccine and testing mandate is facing some pushback. The mandate, announced last week, requires all companies with 100 or more employees to ensure their workforce is fully vaccinated against COVID-19, and for workers who are not vaccinated to comply with weekly COVID testing. The mandate is intended to push about 2/3 of American workers to get vaccinated, but some are claiming it's government overreach. Joining us to discuss this mandate are Dr. Rachel Rubin, Senior Public Health Medical Officer and co-lead at the Cook County Department of Public Health, and St. Karnick, Senior Fellow and Director of Publications at the Heartland Institute. Welcome to Chicago Tonight to both of you. Dr. Rubin, let's start with you, please. Why do you believe it's important for the federal government to mandate the vaccine?
We need to have as many people vaccinated as possible in order to get rid of this pandemic. And throughout the United States, especially our essential workers, are quite vulnerable to getting exposed to COVID. And we need to have vaccine available and provided to all workers throughout the entire country.
Available and provided, of course, but necessary to mandate.
Absolutely. At this point, I think a mandate is absolutely necessary. There has been enough vaccine available to go around for several months now, and we still are nowhere near the threshold that we need to be to have everybody safe. So at this point, we are at the point of needing mandates.
But St. Karnick, you are not a fan of the president's mandate. Why not?
Well, it's unconstitutional. It's simply, you can have a lot of problems out there that you'd like to solve, and you'd like to have the federal government do it, but this is not constitutional. Now, the reality is that this is something that's under what's called the police powers, and the police powers are reserved to the states. The federal government desires to do this, and they want to do this, but they can't, and so they shouldn't.
And just to be clear for the folks at home, unconstitutional, you say, related to police powers. Which clause, which part of the Constitution does the mandate violate?
The 10th Amendment. And also remember that the 10th Amendment refers to a concept that is called the enumerated powers, which means that everything that is not explicitly granted to the federal government as a power and is typically granted to Congress, not the president, is an unenumerated power. If it's not an enumerated power, the federal government can't do it. And in any case, the president can't do these things, even if he has Congress's permission, because it's not constitutional. But even if the Congress does it and it's not an enumerated power, they don't have the right to do it. So there are two places where this falls short. It falls short at Congress, it falls short at the president. This is not something that the federal government has any right to do.
And Dr. Rubin, your department reports that there's currently a high community transmission level with a 7-day rolling average of 408 new cases as of Saturday, and that's in the graphic we're looking at, that's suburban Cook County, Illinois. How is the mandate expected to effectively fight against the rising COVID cases?
I think the mandate now gives, especially employers, the right to say to their workers, you need to be vaccinated or you don't work here. We're going to make the vaccine available to you. We want to have you safe. We want to have our customers safe. And I think that this mandate is the way to go at this point. We need to be protecting the public's health. It's not a matter of individual rights. It's a matter of protecting everybody's health. And that's the mandate of public health. That's what we're supposed to be doing. It means that when I get vaccinated, I'm not just protecting myself, I'm protecting my family, I'm protecting my community, I'm protecting my country.
St. Karnick, part of the mandate states that if you're not vaccinated, then you have to submit to weekly testing before you can turn to work. Is that not a fair alternative?
It is a fair alternative, but the reality is that this is a matter of individual rights. We can have all kinds of things that we want from government, that we want government to do, but there's a reason that they can't do everything they want to do. And that's, we have individual rights. And in a case like this, there's the option of the states, not just the individual, but the states. The states could do this if they wanted to. Few have. So there's a reason for that. President Biden wants to do this very badly, but that's the only way to do it. It's unconstitutional. And this is something that President Biden has a habit of doing. He seems to feel like he hasn't had a good day if he hasn't done 6 unconstitutional things before breakfast.
Okay,
And this
I'm
is
sure
something
there's a lot that we can get into there. But just yesterday, Governor Ricketts of Nebraska spoke with Fox News anchor Chris Wallace on how children have to be vaccinated against a number of diseases in order to attend school. Here's a look.
Why are those mandates that parents in your state must comply with and do comply with routinely, why is it that they're not so objectionable and such a violation of personal freedom, but Biden's vaccine mandates are?
Well, for all those that you just listed, there's a long history that parents have had the opportunity to see how those things have been implemented. And there's still a lot of people out there who don't know what to trust. And in fact, this is really an outcome of what the CDC has done, because they flip-flop on so many issues, whether it's masks or whether you have to mask after you've been vaccinated and so forth. There's just a lot of people out there who don't know who to trust right now.
So, ST, a similar question to you. The Illinois Department of Public Health holds these same vaccine requirements for children in school. Is the COVID mandate much different?
It is, because it's coming from the federal government. That's the big difference. We can't have this kind of interfering in such intimate individual choices from the federal government. If the states want to do it, they have the authority to do it. I'm not sure it's even right on the state level, but the reality is that if one state does it and another state doesn't do it, then at least people have some choice in the matter. They can choose where to live. But when the federal government does it, it's simply not right. It's not constitutional. They don't have the authority to do it.
Doctor, what do you say? What is your response to people who think that the mandate is the government overreaching?
I don't think that it is the government overreaching. I'm not a lawyer. I can't comment on a constitutionality issue. But all I know is that it's also the obligation of our government to keep us safe and to keep us healthy. And without these mandates, whether it's on a federal level or on a local level or state level, and the state of Illinois has these mandates in place, or at least an order in place related to this, is that we know that without these mandates, people are going to die. People are going to die. And I think that it is our absolute responsibility within public health to have these kind of mandates in place when people are not abiding by the guidance that has put in place, which is not mandated. Okay. At this point, we have reached the point where we have to have mandates. Otherwise, people will not do the right thing.
And that is where we'll have to leave it. My thanks to Dr. Rachel Rubin and ST Karnick for joining us.